What if happiness wasn't just an emotion, but a measurable public health tool? Scientists have just discovered something groundbreaking, a happiness threshold that determines whether a country's population gets healthier or not. We already know happy people tend to live longer, have better relationships, and even succeed more in their careers. But new research, published in Frontiers in Medicine, reveals something even more striking. Once a nation's happiness score passes 2.7 out of 10 on the Global Life Ladder scale, deaths from chronic illnesses like heart disease, diabetes, cancer, and respiratory conditions start to drop. Below that 2.7 line, happiness doesn't just feel scarce, it becomes a matter of life and death. The study analyzed 123 countries, measuring happiness, health spending, pollution, and lifestyle factors. Scores ranged from 2.18 to 7.97, with the global average around 5.45. For context, the US scored 6.72, ranking 24th in the world. Lead researcher Yulia Yuga explains that when nations invest in health systems, social safety nets, and cleaner environments, they create a virtuous cycle. More happiness, better health, even greater happiness. Each 1% increase in happiness was linked to a 0.43% drop in chronic disease deaths among adults aged between 30 to 70. That means national well-being can be as impactful as cutting pollution or reducing obesity rates. As psychologist Sonia Lubomirsky notes, happiness is not just about pleasure, it's a public health variable. It's more than feeling good, it's about living longer. But let's be clear, happiness alone doesn't replace medical care or erase hardship. Where you live, your environment, and even political stability play huge roles in how happy and healthy a population can be. That's why experts like Sarita Heshmati prefer to call it a stability threshold. Below it, people live in constant stress or survival mode conditions that literally wear down the body. So what can we learn from this? On a personal level, long-term well-being doesn't come from fleeting pleasure. It grows from strong social bonds, a sense of purpose, and goals that give life meaning. And at the national level, happiness isn't a luxury metric anymore. It's a health strategy. Happiness isn't just about smiling more. It's about living longer, stronger, and together. So maybe it's time for governments to invest not just in medicine, but in meaning. Because a happier world is literally a healthier one.